The Efficacy of Solution-Focused Brief Therapy in Substance Abuse Counseling by Gerald Belnavis for Aspen University. Substance abuse continues to be a serious health issue in our society. The limited resources available for treatment underscores the need for efficient treatment models. Solution-focused brief therapy is a rapidly developing treatment model that holds the potential for delivering positive outcomes in relatively brief time spans. This study examined the body of existing research on SFBT to assess its effectiveness as an efficient treatment model for substance abuse. In examining the available literature, I have found that solution-focused brief therapy has become one of the most popular and extensively used psychotherapy approaches in the world. The model is applicable to most difficulties faced by clients and indeed has been applied to a wide range of problems seen by clinicians. There is growing empirical support for the effectiveness of SFBT in mental health counseling. Miro and Inch in 2009 demonstrated the effectiveness of SFBT in reducing long waiting lists for individual counseling at community-based mental health services. Also, Taylor, Wright, and Cole in 2010, in response to long wait times at community mental health services, utilized a SFBT model to perform the intake function. The results of the study was so impressive that the brief therapy program was expanded. Linton in 2005 enumerated the advantages of SFBT in substance abuse treatment and concluded that the model's client-centered and flexible nature, if applied correctly, holds much potential and promise for mental health counselors in the substance abuse counseling field. Newsome examined the effectiveness of SFBT with at-risk students at junior high school. Newsome found that group participants improved their social skills from pre-treatment to post-treatment, enhanced their social skills from pre-treatment to post-treatment, and improved their classroom behavior. In terms of cultural sensitivity, solution-focused therapists argue that by entering the client's world, accepting the client's perception at face value, and avoiding any imposition of the counselor's perspective, SFBT is culturally sensitive. Procedures. For this paper, I conducted a narrative review of literature concerning the use of solution-focused brief therapy interventions in mental health treatment, with a specific focus on the application of these interventions in the field of addictions counseling. I utilized online sources to conduct a literature search and critical review of a number of studies. The findings were evaluated to determine whether SFBT improves outcomes in patients with substance abuse addictions and if the treatment model achieved these results in a shorter time frame than traditional models. 4 web search terms were used to locate the relevant literature concerning the topic of the study. The search term solution-focused brief therapy and mental health counseling was used to pinpoint literature that covered the use of the SFBT model as a general intervention for mental health. The purpose of this strategy was to provide evidence of SFBT as an established model of mental health intervention. The search terms SFBT and addictions counseling, SFBT and substance abuse, and SFBT and chemical dependence were used to locate the literature that focused on specific examples of SFBT interventions in the field of addictions counseling. References were excluded if more than 6 years old, were written in languages other than English, or if they were not subject to the rigid standards of scholarly research. References were included if no more than 6 years old, included SFBT in mental health and material examining SFBT in substance abuse counseling. Results of the study. Based on the results of this investigation, solution-focused brief therapy has been found to be effective in mental health and substance abuse treatment. FSBT has become one of the most extensively used psychotherapy approaches in the world, producing positive outcomes at a faster pace than problem-focused therapies. Much of the existing research does provide tentative support for the use of SFBT in mental health counseling, particularly as it relates to internalizing and externalizing child behavior problems. Miro and Inch in 2009 have demonstrated the effectiveness of SFBT in reducing long waiting lists for individual counseling at community-based mental health services. Taylor, Wright and Cole in 2010, in response to long wait times at community mental health services, utilized a SFBT model to perform the intake function. The results of the study provided data that was so impressive that the brief therapy program was expanding. Linton in 2005 discussed the advantages of SFBT in substance abuse treatment and concluded that in general terms, because of the SFBT model's client-centered and flexible nature, the benefits of the skilled application of the model to substance abuse issues appear to outweigh the potential difficulties. Smock in 2008 conducted a study comparing solution-focused group therapy with a traditional problem-focused treatment for level 1 substance abuse. The results of the study concluded that clients in the SFBT group significantly improved on both the Beck Depression Inventory and the Outcome Questionnaire, while the clients in the comparison group did not improve significantly on either measure. In terms of cultural sensitivity, solution-focused therapists argue that by entering the client's world and accepting the client's perception at face value, avoiding any imposition of the counselor's perspective, SFBT is culturally sensitive. Chaudhry and Lai, in a study of the cultural appropriateness of SFBT for Muslim counselees, found that the current literature supports the cultural match between SFBT and Muslims America. Recommendations. There is need for further research to unlock the reasons why SFBT seems to result in positive outcomes at a faster pace than problem-focused therapies, even when both lead to successful outcomes. Based on the research data, there is a strong case for the increased use of SFBT techniques in substance abuse counseling. Conclusion. According to the Center for Substance Abuse Treatment, the impetus for shorter forms of interventions and treatments for a variety of substance abuse problems is a result of the increasing body of evidence that validates the efficacy of brief therapies coupled with the increasing demand for more cost-effective forms of treatment. Current research does support the efficacy of SFBT in substance abuse counseling, and I believe that more use of this model is needed.